I am very, very pleased to say that we have formally passed the Omicron peak here in the city of Chicago.
Call it good news, call it welcome news from the city's top doc announcing on Wednesday that, yes, we have finally seen the worst of Omicron.
And Dr. Allison Arwady joins us this morning to talk about that announcement. I want to say good morning to you, Doc. Thank you so much for coming on today. I see a big smile, and for good reason, right?
Absolutely. We are not out of the woods or done with Omicron, but I am very pleased to be seeing our numbers come back down.
Well, I want to ask you, this WHO has said, hey, everybody, calm down. I don't want to splash cold water on this whole thing, but we're going to get another variant, and it's just a matter of time. Here's my question. We know that we had Delta here, and a lot of outcomes were not good here in Chicago. Here comes Omicron. The outcome's a lot better, milder symptoms. Does logic dictate that the next variant will likely be less severe, or does that not come into play? How does that work?
So I wish I knew for sure. What we see, unfortunately, is that variants can emerge that are very mild and not problematic, and we love it when that happens. Variants can also emerge that could make people more seriously ill, could give even more problems with vaccine. And I do just want to highlight that although we've seen a lot of milder illness, a lot of that has been because a lot more people are vaccinated and boosted. And so I would just encourage everybody, regardless, I don't know for sure the next variant, when it may come, et cetera, but I do know that the best protection out there for those severe outcomes, even right now on the way down, is making that choice to get vaccinated. And we do have still, even on the way down, more than 200 Chicago residents every day getting hospitalized with COVID, the great majority of them unvaccinated. So no matter what is coming, it remains the most important thing that you can do to help protect yourself.
So how do you decide like where the peak is, and like basically when you know it's over? Are you looking, clearly you're looking at data, but are you also watching other areas ahead of us?
Yeah, absolutely. So we saw the Omicron variant first emerge and then peak in South Africa, and we've been watching internationally. We've seen similar patterns in Europe, in the UK, and then here in the US, similar things here in New York. It's not just about cases. We saw emergency departments come down, the diagnoses come down first, then we saw positivity in cases start to come down, and just in the last few days, we've clearly seen some of the hospitalizations start to level off. That's exactly what we would expect in terms of being over a major peak here. But I just want to be clear, it's not a sustainable place to be here. The risk does remain high. And so having people continue to be careful as we come down here, we have a long way to go to get back to the point where this is sustainable and it's something that we can live with. But it is an important sign of progress. And I want to thank Chicagoans who have worn their masks, gotten vaccinated, and been extra careful. We do need people to continue doing that for a few more weeks here.
Well, and I'm glad you mentioned, Doctor, wearing the masks, because some would argue you've sort of been our parents. We really haven't had a choice, especially if we want to live our lives, communally with other people. But there are a lot of folks that say, hey, I'm happy if you're wearing a mask. I don't want to be forced to wear a mask. Do we see on the horizon, is there a timeline for when the city might lift the mask mandate?
Yeah, so I would say both around masks and actually the vaccine requirement for high-risk settings, these are tied always to our data metrics. When we get down back to low, moderate risk, as defined by CDC, as defined by CDPH, we would absolutely lift those. We are a very long way from that right now. But I have no goal here except to make sure that when the risk is high for everybody, we're doing everything we can to protect folks. Remember, the mask you're wearing first and foremost is keeping your germs to yourself and helping to protect others. Right. And so while we remain at high risk, that remains a requirement inside. But of course, when we are off of this and back down to moderate and low risk, we would be lifting it. I don't expect that to happen in the next, couple of weeks, certainly. But I'm hopeful that, as we get into the spring, if all things continue to go well, we hopefully will be in a place to do that. And the more we can get through this with fewer infections right now, the more we are able to keep coming down more quickly.
Well, the Biden administration is going to be sending out masks to every American so that they can have these better masks. But my concern concern with a lot of people is that they may just stick with these because they can't find that brand in the store, and that they'll be using these over and over again. At what point do you need to think about, like, not using that one, getting on to the next one?
Yeah.
Don't reuse. I mean, what do you want people to know about that?
Yeah, absolutely. First of all, the most important thing continues to be everybody wearing the mask. The biggest jump is that when everybody is having something covering their mouth, that helps keep germs in. We are recommending at this point, just with high risk, either if people have those surgical masks, the paper ones, if you're wearing that and putting a cloth one over it, or if you are going to wear one of the KN95 ones, the city actually got ahead of the feds there, and we did put about 1.5 million out over the last week. They are widely available in the marketplace. They're not that expensive, but you can reuse them. We have guidance on our website. We encourage people to, be washing your hands and using hand sanitizer as you're taking them on and off. If you're going to store it, just store it in a dry paper bag. That's good for it. It helps it dry out. You only cannot be reusing it in the community setting if it's soiled, dirty, if it's stretched out, if it's not covering your nose and mouth anymore, or if you're having any difficulty breathing through it. Otherwise, you can continue to reuse it, and we've got guidance online about that.
Dr. Allison Arwady, the city's top doc. Thanks so much for your time. As always, good to see you.
Thank you.
8:43 still to come on Good Day Chicago.